So have either of you thought about what you're going to do with your asthma once you leave home?
Well, how would I go about transferring my prescriptions to my college or wherever I am?
That's a really good question. Once you leave high school and you're going to a new job or a trade school or to college, you need to be able to remember that you're taking your asthma with you. You don't get to leave it at home when you leave. So once you do leave home, you need to go and find a pharmacy that is close to where you're going to be. Once you find that pharmacy, take your current prescriptions, your insurance card, and go and see a pharmacist there, and they will assist you in transferring your prescriptions. But most importantly, before you go, I want you to learn what medications you're on, what they look like, and what they're for. Because when you go and you get a new prescription, we want you to make sure that you're getting all the correct things that were prescribed for you from your physician.
Take control of your asthma. Remember, locate a pharmacy close to where you're going to live. Take your current prescriptions and insurance card to the new pharmacist. Understand the purpose of your medications.
When your asthma flares up and you need immediate relief, which medication do you reach for? Your rescue inhaler or your controller medication?
My rescue inhaler. I use albuterol before every baseball game.
Well, I do color guard and I do take it, but I'm still having symptoms.
That actually is very common and that can happen a lot. It might seem obvious when you need immediate relief, you know to use your rescue inhaler. However, if you're continuing to have symptoms, you may need to speak to your physician and get on something called a controller medication. With your rescue inhaler, or albuterol, that is allowing more air to get into your lungs and allows immediate relief. However, when you get on a controller medication, they work a little bit differently and they decrease the swelling and the mucus that happens in your lungs. And once you have that medication, you won't need your rescue inhaler nearly as much. If you have further questions on those medications, you can always talk to your pharmacist when you pick up your prescription, or contact Breathe Pennsylvania and ask for a student asthma kit. You'll get a peak flow meter and a chamber, and that way you'll know exactly how to use all of your medications.
Remember, if your symptoms persist, talk with your physician about a controller medication. Controller medication decreases the swelling and mucus that occurs in your lungs. If you have additional questions, contact your physician or pharmacist.
My doctor sometimes tells me to spray my inhaler in the air. Why would I do that?
That's a really good question. That is actually called priming an inhaler. Not all inhalers need primed, but there are some that are aerosol, and what the doctor will tell you to do, or the package insert will tell you to do, is to shake your medication and to spray it once in the air. What that does is that brings the medication down the canister, and then it'll be ready for you to use.
Remember, most inhalers are aerosol, but not all inhalers need primed. To prime an inhaler, shake your medication and spray once into the air. If you have further questions, contact your physician or pharmacist.
So, are you getting the correct dose from your asthma inhaler?
Well, why wouldn't I?
Well, that might seem like a funny question for me to ask you. However, there's a management tool that can make sure that you're getting the correct dose to your lungs. It is called a spacer. When using just an inhaler, you may not realize that most of the medication goes into your mouth and hits the back of your throat, and a lot of the medication just gets swallowed into your stomach. This picture here shows you the difference of how the medication can reach your lungs using a regular inhaler and a spacer. And as you can see with the spacer, most of the medication reaches the lungs.
I don't use a spacer, but maybe I should. After seeing that comparison, it seems kind of weird.
You're exactly right. It's kind of amazing to see how much medication you're losing by just using an inhaler. Let me show you how to use a spacer correctly. First, you'll have the spacer and you'll have your inhaler. The first thing you need to do is remove the caps from both of them. Then you'll need to shake your inhaler. You want to place the inhaler in the back of the spacer. Once you have this done, you're going to want to exhale slowly to get all the air out of your lungs. Then you'll place the spacer in your mouth Press your inhaler. The medication will then go into the chamber, and you will want to slowly inhale it into your lungs and hold your breath for approximately 10 seconds. Once you do that, you can take the spacer away and breathe regularly. One thing to remember is that there are a lot of spacers that will whistle if you are inhaling too quickly. You want to just make a nice gradual inhale. If your doctor has recommended 2 puffs, you want to wait 1 minute in between and then just redo the steps that we just talked about.
Well, no offense, but I don't really think I can carry that around all day with me. It's too big.
That's a really good point. When you contact Breathe Pennsylvania and you get your student asthma kit, in the kit is something called a paper spacer, and I think this would work better for you. It works just like the regular spacer. It lays flat and you just pop it open. You would follow the same directions that we went over for the regular spacer. You'll shake your inhaler and you'll place the inhaler in the back of the spacer. You're going to want to exhale completely, place the spacer in your mouth, press your medication, and inhale slowly, then hold your breath. Remove the spacer, breathe normally, and repeat if your doctor has advised you to do so.
That's a lot more convenient.
Remember, spacers help deliver more medication directly into your lungs. Some spacers will whistle if you inhale too quickly. Be sure to inhale slowly when using a spacer. For your convenience, Breathe Pennsylvania's student asthma kit includes a cardboard spacer.